Everyone, welcome to the Diversitea webinar on inclusive policymaking tools. My name is Annabella Linko. I am a co-chair for the National Science Policy Network's Diversity, Equity, and Inclusion Committee. And we are so happy to have all of the authors on a recent publication, as you have seen here, from the Journal of Science Policy and Governance. I'll be doing a quick bio for each of the four, and then I will let them take the presentation away. So, Chris, if you could go to the next slide. So in order, and feel free to use their Twitter handles if you are on social media talking about the webinar. From the left, Ans Irfan is a public health scientist with a focus on achieving global health equity through public policies and systems change. He is a Robert Wood Johnson Foundation's Health Policy Research Scholar, also serving as a faculty member at George Washington University, a principal investigator at Public Health Analytica, and policy director with the DrPH Coalition, Inc. He is also a full-time dual doctorate, so a doctorate of education and a doctorate of philosophy student. Ankita Arora is a postdoctoral fellow at the University of Colorado Anschutz Medical Campus with expertise in biochemistry and molecular biology. She's trying to understand the zip codes in brain cells that decide brain transport mechanisms. She currently serves as the Regional Liaison for the Asian Pacific region within the NSPN's Diplomacy Committee, and is an Associate Editor at the Journal of Science Policy and Governance. Chris Jackson is a fourth-year chemistry PhD candidate at UC Berkeley, where his research focuses on the development of nanomaterial tools for biomolecular delivery and sensing. He currently serves as the president of the Science Policy Group at UC Berkeley and is the workshops director for the Engineering and Scientists Acting Locally, or ESAL. And last but not least, Dr. Selena Valencia is a National Institutes of Health T32 postdoctoral fellow in cancer epidemiology at the University of Arizona Cancer Center. Selena's research utilizes a data science approach to better understand the intersection of biosocial consequences of social determinants of health in breast cancer mortality disparities experienced by Latina and Black populations in the US. Selena has served as the past co-chair for NSPN's DEI committee. Currently, she's the member of the CDC's Nutrition and Obesity Policy Research Network and is working on an NIH and NSF funded initiative to strengthen the data science pipeline for underrepresented groups in the Southwest. So let's welcome them all, and I will give you the floor.
Great, thanks Annabelle, and thanks to NSPN for the invitation to chat with y'all about some of our work today. We're going to start by, I think this is an audience that is very familiar with some of these terms, so we wanted to give you our perspective and kind of some of the terms that we'll be using today throughout our presentation. So specifically focusing on diversity, equity, and inclusion. For diversity, we're generalizing that term to think about the ways in which people differ, and really thinking about encompassing a wide spectrum of perspectives, versus equity, where we're talking more about fair treatment, access, opportunity, and advancement for all people, and really thinking about how we can ensure an equal playing field. And finally, inclusion, making sure that a wide variety of different people have power, a voice, and are really included in the decision-making process. And we can, we're happy to chat more about these when we move into question and answer and kind of discuss how these play a different role in the policy-making process. But the main focus of, or one of the main focus of our memo and some of the work we want to talk to you about today is really using these definitions and more broadly using inclusive policy-making tools in response to the COVID-19 pandemic, the ongoing pandemic, I should say. And to kind of preface and give you some perspective on this. Given that we are still in the midst of a pandemic, it's worth noting that research has already shown that more equal societies, societies that better include and use DEI principles, are better able to control pandemics, right? So this is looking at data just in the past couple months or so, but when you compare countries that are by various definitions more equal, they have seen greater success in controlling and in lower COVID-19 death rates as compared to other societies. So this is just a high level overview. We think is important to kind of motivate why you should care about DEI policymaking principles, particularly in light of the pandemic and beyond. So with that, we want to highlight, as we were writing this in March, when a lot of things were happening, we really wanted to emphasize that these issues are not new. These are issues that policymakers have been dealing with across the country, across the world, have been dealing with for decades. But a lot of the inequities that we see, and a lot of the inequities that can be addressed by more inclusive and better DEI policymaking tools, have been exacerbated by COVID-19. And so we really just want to give you kind of 3 case studies in business and employment, education, and then in healthcare, specifically on how a lack of a DEI lens, or perhaps the use of a DEI lens, can enhance policy responses, particularly in light of COVID-19. So dive into each of these in a little bit more detail now. For business and employment, I think this is one that many of you are probably familiar with, but we particularly wanted to highlight, for example, the CARES Act funding, which was released earlier this year. Despite aiming to prop up a lot of business and ensure employment levels, the way that it was designed and delivered kind of through existing banking systems led to some studies projecting that 75 to 95% of Black, Latino, and AAPI owned businesses have almost no chance really of receiving a PPP loan due to not having previously existing relationships with some of these banks, or a general unwillingness to engage with these systems. So this is one example of how inadvertently some of these well-intentioned programs, without being constructed without a necessarily specific focus on equity, have resulted in an unequal distribution of resources. And similarly, we all know that job losses are as well unequally distributed due to a large majority of job losses, both temporary and permanent, are occurring in service industries. So this is just one example where we highlighted a better use of DEI policymaking tools could perhaps lead to a more equitable and better recovery. The second pillar I want to highlight here is education. So thinking about, again, going back to CARES Act funding, kind of looking at first at the higher education level. So the CARES Act funding, as some of you may know, set aside pots of money specifically for higher education, but the way that it was distributed was through part of that formula that used to distribute funding was the use of Pell Grants. So schools that had more Pell Grant recipients would receive more funding. While this may seem well-intentioned, this distribution formula does skew funding towards those more expensive schools, which have more students that use those Pell Grants. So just kind of give you some perspective on how this played out. For-profit schools, which represent approximately 5.5% of all students, received 9% of the funding from the CARES Act that was dedicated towards education, versus community colleges, which serve much higher percentage of students, received less than that, only about 22% of funding, specifically because of this. So just one example where, again, we wanted to highlight the inclusion of DEI kind of considerations in the policymaking process is important. And then remote instruction as well. We all are obviously remote here, and a number of studies already starting to show that the quality of education is significantly segregated depending on race, depending on income. And we have seen specifically, 30%, the number of students who are likely to receive a decent remote instruction drops significantly when we're looking at minority communities, including Hispanic and Black students, which has long-term repercussions beyond the pandemic, obviously. So this is something that will continue to have to be addressed continually as we're moving forward with remote instruction and also beyond as we think about how we can recover and help those students catch up. And finally, in healthcare, again, the inclusion of DEI principles and kind of thinking about who gets access to quality healthcare is an important consideration, we believe. If you look at some studies in New York, for example, the hospital quality of care, we were already seeing that patients in community hospitals are much more likely to die than patients at private medical centers. And this is a result of not just maybe necessarily access to immediate treatment, but more long-standing inequities in terms of resource distribution and other issues that are at the heart of how we can reform our healthcare system in light of COVID-19 to make it more equitable and inclusive. And again, as we kind of think about with all the news about COVID-19 vaccines coming out this week and recently, thinking about how those treatments are distributed and who has access to those in terms of having health insurance. Again, CARES Act has made some steps towards this, but neglects really a large portion of the population who is newly unemployed or disproportionately without insurance, which again, disproportionately impacts people of color. So these are kind of the three buckets that we want to frame on, and to kind of expand some policy recommendations around it. We developed a set of tools that we believe will be useful as policymakers across all different levels of government, kind of try and move forward throughout this pandemic. So here's the kind of the toolbox, and we can get into these in a little bit more detail as people are interested in different sections. But broadly, the 6 main categories that we recommended policymakers kind of use and develop different tools in order to ensure their policymaking practices are more inclusive include equity and impact assessments, as well as individual positionality assessments, better mainstreaming policymaking processes, including more community engagement and citizen e-consultation, taking advantage of new tools, as well as big data. So happy to chat more about any of these, and I'll let anyone else jump in here if they have more thoughts.
I'm actually perfectly comfortable with awkward silences, so I kind of enjoy it. So it's totally fine with me.
I actually think, since you so perfectly encapsulated a 5-minute flash talk, would you be willing to talk a little bit more in depth about sort of the toolbox that you all created and the different components and its importance to the policymaking process?
Sure. I guess I just want to start by saying that I don't think we did anything that was earth-shattering or exceptionally novel or by any stretch of imagination. We just went out and gathered what was out there and put it together for folks who do want to engage in this sort of work. So it's kind of easier for them to, you know, not having an excuse that, oh, I don't know how to do it. But other than that, it's sort of like pretty much what it says on there on the screen itself, that the idea there really is that we should be able to reach out to communities, but in a meaningful way, because more often than not, the challenge is, even in our federal policy, some of the regulations which may require community consultation, that's done in a very nominal way, not in a meaningful way. And the idea of diversity and inclusion really is And this is something I think like few people who were generous enough to join us. One thing I just want to point out, the idea of inclusive policymaking is that diversity and inclusion are just processes, they're not the outcomes that we're after. The idea is that you engage communities, bring them in, and then cater your policies according to their needs. And now that may very well mean that you need to go back to the drawing board and redo the whole thing, and that's fine. So this is all to say that it's harder work than a lot of the corporate hijacked version of diversity and inclusion would lead you to believe. So this is sort of like, focusing on that part that some of these tools are on here. And I won't bore you all to sort of like going through all of it. But the idea there really is that sort of like use some of these tools to reach out to communities in a meaningful way, but then actually listen to them and incorporate that into your policies or programs, whatever it is that you're developing.
I think that I also want to chime in and disagree a little bit with Ans, because I do think that equity is part of the outcome we are looking to achieve. We want the policies to equitably serve as many people as possible, but that does require a new lens for the creation of the policy. And that's so that's important. So how do you reach people with different positionalities if you have a limited subset of individuals writing policies that make sense for their life? And so that's, to me, I think there's an interplay there on both the process of the policymaking as well as the outcome you're seeking to achieve.
Diversity and inclusion, Selena. So I wasn't referring to equity and justice. So those are the outcomes we're after, certainly.
I believe you said equity. That's why I chimed in.
Oh, okay. Gotcha.
Yeah, I would definitely add on to something here where, as we all are currently in a pandemic, and resource opportunities such as town halls or in-person engagement is less. But I would want to point out that given all of that, still there are enough e-resources available, thankfully, because of the expansion of the internet. Like resources that we could capitalize includes like online working groups, includes like online surveys, and not to mention or not to forget the importance of the big data here, like social media such as Twitter, Facebook have a big impact. So though we are restricted in some ways currently, but I feel there are opportunities that have come up on hindsight as well.
Well, while we sort of encapsulated, I think, all of the panelists' opinion, there are a couple of questions in the chat that I'd like to sort of start the Q&A session with. And the first one asked a little bit about any suggestions encouraging inclusive policymaking when you're in a relatively junior position. And you're not the kind of key decision maker, especially since to do work effectively, this requires kind of creativity and time, and that's not necessarily a priority. So feel free to chime in.
I have a clarifying question. So do you mean somebody who's in a junior position as a scientist or a junior position working in policymaking?
Policymaking.
I would like to chime in and say, I think using evidence for what we are asking is the way out. Let's say there is what you're asking for in terms of inclusivity. There are reports existing that is not currently happening, and there are reports existing that how does that negatively impact. Using those evidences as your talking points would get you far, even if you are at a junior position, because people higher up would realize that what you're talking is not coming from just hearing about things, but there is evidence to prove, and there's evidence to prove. How does that eventually help them as well?
I would say one solution would be collaboration and making friends, right? So the more collaborators you have, the more you can shift the burden. So while if you do it alone, it would be very time consuming, but if you had multiple people, like people in NSPN who have this interest, they could also help with doing the fact finding and the evidence and help for creative solutions. So I think that would be sort of a key step that a junior person in a policymaking office could take, is to build coalitions and to build a team of people they can work with to think about these issues.
And I also want to say, like, you know, often like people who may not be as inclined to integrate diversity, equity, or inclusion into their policies, evidence-based policies is one of those things that, like, you know, few people could argue against. And a lot of these things, like, you know, they're not thoughts and opinions. There's plenty of evidence out there that these communities, especially who fall at the intersections of a lot of these isms, from sexism to racism onwards, that they are paying the biggest price in our inequitable society, thanks to the social vulnerabilities that we create. So we do have plenty of evidence. So as far as junior folks who are concerned in the policy-making sphere, I would really say that, like, you know, use that I am just sort of like using evidence to create an evidence-based policy or program. And it all boils down to basically translating existing evidence into policies and programs. And I think that's what our main job should be as scientists to begin with. So this is all to say that there's plenty of evidence out there that exists, but we get to look for it a little bit in a more deeper way, and then be able to use that in those positions where there are power dynamics and you may not have the privilege of sort of like, you know, firing your boss, if you will. But in those particular situations, you could still argue that there is this credible evidence that's out there, and I want to be able to integrate it into policies and programs.
All right, I'm just trying to figure out how best to ask this next question, but it talks a little bit about what you've had in the article and how Black Twitter was a potential avenue for engagement with the Black community. Was there ever a discussion when you were creating the paper considering faith-based efforts? So the example listed here from Jasmine George is referring to sort of African-American culture, particularly Southern culture, where the church serves as a hub for information and community engagement.
So Jasmine, this may not be listed specifically on there, but that's what we really mean in terms of, like, when we're thinking about a particular community, how do we approach that particular community in that way? But I'm glad you bring up the faith part, mostly because not many people talk about it or think about it. I would love to either reach out to you or have you reach out to me. I'm working on a couple of projects right now that are focusing on engaging the faith-based communities for climate change communications, as well as immunization related to COVID-19, what are the barriers and how can we use sort of like, you know, collaborate with these faith-based institutions to kind of alleviate that institutional mistrust that was created by historical, you know, challenges. This is great. Thank you for raising that.
Yeah, and I would just follow up on that, that a lot of times, since you as a outsider might not be a trusted person to get into the circles, what really helps is having a trusted member within the community who can act as a mediator to bridge that gap, especially in communities such as faith-based communities, or communities that basically have kind of less trust to people who are from the outside than their communities. So definitely look for a trusted partner within those communities and use that to get inside and talk about those issues.
As sort of a follow-up, since there was a sort of two-part question here from Dane, are there ways to identify gaps in those specific stakeholder feedback collection mechanisms that you have found through your sort of literature review and search?
Ans, go ahead first.
Mary, go ahead, Ankita, please.
Yeah, I would say definitely as of currently, I think access is a big gap. Like even if these mechanisms that we've talked about exist since ages, like citizen juries and citizen panels are not new things that we are advocating for. The problem thus far has been that only the privileged population have been engaging in them. So yes, there is a gap in terms of like either people are not, like there isn't access for underprivileged people to be aware of them and how to participate. So yes, we are asking for opportunities here to make that participation easier.
And I think that was one of the roles, like one of the reasons we liked big data, because it's passively collected. So you're not asking people who are already suffering through a crisis pandemic situation to do additional work, but rather allowing them to kind of live their lives and using these big data tools to be able to kind of glean what is going on in these communities. And I think a little bit of that is also seen in the citizen e-consultation. So those could be two mechanisms where you look at how closely you are to achieving the desired outcome, mostly because those aren't asking people to do anything additional when they're, going through a rough time.
I guess in relation to this, there was a bit of a larger discussion in terms of location-based inequities. And if you had seen that in your research and how policymakers can begin to either address or ensure that these displaced communities received aid for more equitable policies.
I'm not sure if I'm going to be answering that question, but I will say that sort of like the idea of like a lot of this stuff is that these are, again, like part of the reason we call these tools and not so much frameworks, or did not make an attempt to write it such that it looks prescriptive, that it's going to vary depending on the community or the challenge or issue or whatever policy or program that you may be trying to engage in. So these are all there, and end of the day would sort of boil down to your own judgment on how do you want to engage that particular community and what gaps do you identify. But there are these things that you can use readily available, basically, existing mechanisms from interdisciplinary perspective that can lead to more equitable policies by including community voices. So that's sort of like, again, like I would just sort of like try to stay clear of like looking at it as sort of something which is prescriptive, but rather there is a range of these tools that, and depending on the situation, you are able to engage a community in a more meaningful way. And I would also say when it comes to communities, we often think about, leaders in communities and so on. And that discussion in practice is not inclusive in itself, because like that treats a lot of these communities as a monolith. And that's like seldom the case. So thinking about it more critically, when we really apply that intersectional lens, that's when you sort of like, begin to see that what are the actual needs and which specific tool and multiple set of tools that you may be able to use to really tap into getting a more cohesive, bigger picture of community needs, and then adapt your policies and programming accordingly.
Yeah, and specifically on like location and gentrification issues, I think that also comes with it in terms of the systemic change that we are calling for these days, right? Like you have to go back to the reason why is there low income neighborhoods existing? Like how is the boundaries of our counties decided? And all that has led to a larger problem that we're facing now. And a part of that also involves a systematic change to address those issues, which is beyond the paper that we are currently discussing. But I just wanted to point it out that those issues go way deeper than just making tools for policy making that are more inclusive.
Yeah, and I'll add in that one of the discussions we had when we were writing this was specifically thinking about what kinds of groups could make the most use of these tools. And we did identify that local communities are typically, local governments are typically under-resourced compared to, say, the federal government or larger entities, and may not have a lot of these existing tools or practices. So I really think that, especially in light of COVID-19 and many of the changes and increased interest in local engagement, that using some of these tools, and there's really an opportunity to kind of insert DEI policymaking in the local level as we continue to deal with the pandemic and recover moving forward.
Okay. I do want to be things first. You can find today's slides at the link below if you are interested in some of the links that are present or just some of the information there. And I hope all of the breakout rooms were useful and engaging for you all. For all of our panelists, are there any final thoughts you want to address for the audience? Are there any final questions you'd like us to address before we close out this session?
No, they're welcome to reach out if, however we can support, throwing my co-authors under the bus, however we can support them. So please reach out.
Yeah, and I would just add, Dane mentioned in our breakout room that if you're looking for disseminating this outside JSPG, yes, more the outreach, the better it is. And I think especially reaching out to local government levels is highly important currently. So if people find ways to engage local government and need help with handling out the infographic or writing an op-ed, we are happy to assist you with any of those efforts.
Yeah, absolutely. And my breakout group, I'm looking forward to taking over Georgia with y'all. So please keep in touch.
Absolutely.
Awesome. Well, with that, I want to thank everyone for participating and joining us for this webinar. Some housekeeping items. You'll be able to find a recording of this webinar on YouTube. You can follow or subscribe to the SciPol Network Media channel. You can find additional science policy webinars and the rest of the ongoing Diversitea series there. And so once this is all done and set, we'll have this uploaded. You can also find on there the most recent 2020 NSPN Symposium Flash Talks playlist, where many of the talks discuss sort of DEI advocacy and inclusive outreach, policymaking, those sorts of things. And for this audience, I think you'll find that interesting. And the committee that sort of brought this all together was the Diversity, Equity, and Inclusion Committee, but feel free to reach out and explore the National Science Policy Network at large. You can follow us on Twitter and Instagram. We also have a Facebook and LinkedIn. And you are more than welcome to join the community at scipolnetwork.org. And if you are interested in learning more about DEI within the science policy space and what our committee is doing within NSPN, feel free to reach out to Ian and myself, the current co-chairs for the committee. We can be reached at DEI@scipolnetwork.org. Some DEI